Good afternoon. My name is Julie Gibbs. I'm the director of the Riley County Health Department and also your local health officer. I'm going to give you your update in regards to COVID-19. Today we learned that Riley County has 2 positive cases of COVID-19. We know that one individual is a 57-year-old female who resides in Manhattan and also has a home in Topeka. She traveled to the Kansas City area last weekend, then returned to a private residence in Topeka. She was tested in Topeka on Monday and has been in isolation in that location ever since. She did not travel anywhere in the Manhattan area since being exposed. This individual did everything right. When symptoms started, she used a mask, then self-isolated and notified the hospital before going in. The other individual is a Fort Riley soldier that also has tested positive today. This individual resides in Manhattan and currently does not require hospitalization. He remains at home in isolation. The U.S. Air Force Medical Services at Wright-Patterson Air Force Base conducted the COVID-19 test. Upon receiving the confirmed test results, Fort Riley public health officials notified the service member, then notified KDHE in accordance with CDC guidelines. Please know that Riley County Health Department and the Kansas Department of Health and Environment are doing everything possible to make sure the public is safe. The Health Department is currently doing contact tracing and appropriate investigation to stop the spread and reduce risk of exposure. We still have 6 pending cases here in Riley County. We have 19 individuals in quarantine being monitored daily. Statewide, there are 168 positive cases as of today. This has gone up by 42 cases since yesterday. Of these 168, 90 are male and 78 are female. Given the sharp increase in numbers in the past few days, we are currently formulating a stay-at-home order. We will be certain to give everyone more than 24 hours before we implement anything. This is a very difficult time, but we will get through this together. It is still so important that you please stay home, unless you need essentials such as food or health care. Please remember the screening call center if you are experiencing symptoms such as fever, cough, shortness of breath. That number is 785-323-6400. Please follow the Riley County Health Department Facebook page or go to the Riley County website at rileycountyks.gov and click on the coronavirus link at the top. You can also check out the KDHE website at kdheks.gov. Remember to continue to look after your neighbors, the elderly, or those with pre-existing medical conditions. Please be patient with each other and know that we are all in this together. I'll now take questions.
First, we have some questions about contact tracing for the Fort Riley service member.
Sure.
If you would repeat the question.
Okay, first let me introduce myself. I'm Lieutenant Colonel Terrence Kelly. I'm the Public Affairs Officer for the 1st Infantry Division of Fort Riley. And the question we were asked is about contact tracing for the Fort Riley soldier. That investigation is currently underway. I do not have those results in front of me right now, but we are working on that in coordination with the Riley County Health Department so that appropriate individuals can be notified.
This is a question about symptoms in regard to the woman who is in Topeka. Is it normal to show symptoms as quickly as she may? Can you talk about how soon people show symptoms once they've been exposed?
I'll let Andrea answer this. Yeah, thank you.
And if you would introduce yourself.
Yes. So my name is Andrew Adams. I'm the Public Health Emergency Preparedness Coordinator for the Riley County Health Department. The question was about symptom onset and the time between exposure and the onset of those symptoms. The average time, according to the CDC, is about 5 days, but in general for coronaviruses, it's anywhere from 2 to 14 days. So it does make sense that she would fall into that range after exposure for symptom onset.
I have a follow-up question to that. With the 2 to 14 days, that's after exposure that she would have the symptoms show up. Is that correct?
Yes, that's correct. The average incubation period for most coronaviruses is 2 to 14 days.
And this question is probably for Officer Muldrop. What kind of verification should essential personnel keep on them if they are traveling to work? Is that necessary at this point?
Okay, my name's Kurt Muldrop. I'm the Assistant Director at the Riley County Police Department, and the question was asking about what kind of verification papers people should keep on them if they're traveling to and from work. As we talked yesterday, we haven't even discussed any travel restrictions, any kind of need for paperwork to travel, so the answer would be none other than your normal identification.
How old is the soldier, Fort Riley soldier that contracted the virus?
So this is Lieutenant Colonel Kelly again, and the question is, how old is the Fort Riley soldier? Unfortunately, I don't have that information with me, but I'd be happy to follow up with you.
In regard to the Topeka, the person who's residing in Topeka, are we going to check on her contacts prior to her trip to Kansas City? And that was last Wednesday, I believe.
Yes. So the question is, are we going to check on the patient in Topeka, her contacts that she made last week? And yes, that is currently under investigation.
Talk about the timeline for her travel away from Manhattan.
Sure. So the question is her timeline as far as travel away from Manhattan. Last week, that individual was in Kansas City, in the Kansas City area from Wednesday through Sunday, returned to Topeka on Sunday evening, presented at the hospital on Monday where she, and then went back home where she still is in Topeka.
And then I have a question regarding the originally reported Riley County, now known as Potawatomi County case. I've seen notification that he has been released from the hospital. When will his case be considered a recovered person?
Andrew, do you want to take this?
So this is Andrew again from the Riley County Health Department. The question was about the original case that was reported from Riley County. That's a Manhattan resident. He was released from the hospital a few days ago, and in terms of his period of when he's no longer considered ill, it comes back to symptoms. So when those symptoms subside, there's that certain time frame. It could be 72 hours after fever, or it could be a bit longer depending on the other symptoms. It's really done in consultation with his healthcare providers, along with the Riley County Health Department and KDHE.
Next question, is this now considered community spread and will a stay-at-home order be issued?
We're still looking into it as, the question was, is this considered community spread and will there be a stay-at-home order issued? We are still looking into if there is community spread. That's still to be determined, but we are currently looking into a stay-at-home order.
To talk further about that, the EOC has been working most of the day at trying to craft a stay-at-home order in the event that we need to go to that. So we want to again encourage people to do the best they can to stay at home without an order in place, restrict their movement. And I can't help but go into saying that the stores will continue to remain open. The grocery stores, pharmacies will be open. So avoid panic buying, even with the thought that we may be moving towards a stay-at-home order. The grocery stores and pharmacies will stay open. Don't go out and buy more toilet paper unless you need it.
Next question involves where the soldier may have been exposed.
So this is Lieutenant Colonel Kelly again, and the question was for the Fort Riley soldier who's been confirmed positive, if we have any idea where he may have been exposed. So in the previous week, the individual had been on vacation in California during the spring break period. So we believe that it was, he may have contracted it there, and then on returning to the area, in other words, I believe the term we used was imported into the area as opposed to community spread. Now, I'd also like to emphasize here that At Fort Riley, we've implemented a quarantine program in accordance with the Kansas Department of Health and Environment, their mandates. So, and actually right now we are exceeding what's required. As of today, everyone who has traveled outside the region, but even a week ago, any individual that had traveled to a hot spot is being placed into a 14-day quarantine period. We're doing that to ensure that we're doing everything possible in coordination with the county and state officials to prevent the spread and protect the communities as well as our people.
Can one of you help define the term community spread?
So this is Andrew again from the Riley County Health Department. So community spread is the term that's used when there are multiple cases in the community that are not traced back to another location outside of the community.
I have another question regarding definitions of terms that are used. What is the difference between what is being labeled as quarantine as opposed to isolation?
Sure. So the question is about the difference between isolation and quarantine. And when it comes to quarantine, quarantine is for those individuals who are not sick but may have been exposed to an illness, so in this case, the novel coronavirus, where isolation is for those individuals who are sick and are displaying symptoms of illness.
Was the woman that was in Kansas City, did she likely catch the coronavirus in Kansas City?
So the question is about where this new case for Riley County was potentially exposed. We're working through those scenarios and trying to figure out exactly where she was, where she may have come in contact with the illness or with the disease.
The next question about testing guidelines and who will be tested.
Go ahead.
So the question is about the testing guidelines. Currently, KDHE has issued guidelines that outline exactly who should be tested, and those are limited in terms of certain criteria that need to be met, and it's anyone from high priority, high impact potential cases, ranging from first responders to those with other comorbidities and those in the hospital.
This is another question about the Fort Riley soldier. Can you talk about how people will potentially be notified, as in people who may come in contact with this person, the unit numbers or worked with them, how will they be notified if they had potential close contact?
Okay, this is Lieutenant Colonel Kelly from Fort Riley again, and the question was about, for the Fort Riley soldier, how will individuals he may have been in contact with been notified? This is where we're working with the Kansas Department of Health and Environment, as well as Riley County in this case, to both conduct the trace investigation and contact individuals who may have been in contact with him. I do not have those investigation results with me right now. That is ongoing. I do know that the individual, upon returning from California, went directly into quarantine, thus limiting some of his potential exposure. However, we will be looking very carefully and continuing to work with Riley County to make sure that those notifications are made.
I have a point probably we need to clarify. Kurt Muldrop with the Riley County Police Department. We were talking about community spread being a potential trigger. I want to understand, or everyone to understand, that's not the only trigger we're looking at, that we're also looking at other factors and really trying to determine the threat to the community from surrounding communities. So we'll constantly be assessing that, and that will also play into a part of when we decide that it's best for the public to move forward with a stay-at-home order, so not just community spread.
If a stay-at-home order is issued, who decides what essential businesses or essential functions are?
That is already, I'm sorry, the question is who decides what essential functions or businesses are. The governor has already laid that out, some general terms, and then locally we will look at what we believe fit her guidelines as well as fit with what we believe needs to occur within our jurisdiction.
As far as what businesses are open now,